I'm going to most likely point to you what you need to concentrate on. But right now I'm just giving you an overview. This is the anatomy of the heart, if you will, model. And you can see that there's this ear-like flap. This is known as the ultracle. And the functions of the ultracle just gives the chamber of the heart bigger room. And of course, the chamber of the heart on this side, this will be considered as the right atrium. And it's hard to test what is the right atrium is, right? So generally, I put a red spot here, and people say, "Oh, that's an ultracle. That's fine." You said that's the right atrium. That's fine too.
Is it the same as the auricle?
Yeah.
Okay.
But it's really this space here is ultracle. It's AURICLE. Which is the ear-like flap. But the space here is your right atrium. Of course, you know that this is your right ventricle. Okay. This is your left ventricle, and this is your left atrium, as you will. Notice the wall. On the left-hand side, it's much thicker on the right-hand side, right? So, you know, like around maybe at 10 o'clock, we're trying to get home early today, because you don't have a lot. But you can look at the sheet heart. You know, I can throw in a trick question for you to ask which was the left or the right ventricle, because it depends on the cut. If it's cut like this and you look this way, this is always the left, right? But you can also present it this way. So then if you view this side, then this is the thicker side. It's on the right-hand side, for example. But it still will be left ventricle. And you know the left and the right just based on the thickness of the wall. Okay?
How can you tell the thickness of the wall if it's turned around?
It would be still thick on this side. So it's not the side that is matter. It's the size of the thickness of the wall that will determine that it's left ventricle. It's not always going to be on this side as your left, for example, in this case. So this is your right, this is your left. This is the septum or wall between the two ventricles. So this is considered interventricular septum, right? And here's your atrioventricular valve. This one on the right-hand side, also known as your tricuspid, and this is your tricuspid. So most likely, if I want the answer is the bicuspid or the mitral valve, I'll try to put it here, okay? So the closer to tell you that's a valve. But if I put it here, this is usually indicate that's the heartstring or the chordae tenonate, okay? That's the chordae tenonate, whereas up here is more like a valve, okay? And these are one-way valves, of course, it's atrioventricular valve, then the blood will flow from the atrium into the ventricle, right? Now, you also have this valve right here. For you number is like, it's 101, 102, 103. There's different kinds of flap or cusp. So you look down here. You don't need to know specifically each one of these. Just know that these are your aortic semilunar valve. Okay? See how aortic, sorry. That is not the aortic semilunar valve. Sorry. That is your pulmonary semilunar valve. This is your aortic semilunar valve, the one, this one.
Sorry, where's the pulmonary semilunar valve?
That's the one I showed you before is pulmonary semilunar valve. Yeah, that is the pulmonary semilunar valve. This one right here is your aortic, okay? This one right here. Number would be 104, 105, 106. And it's called aortic because it's coming into this blood vessel. Okay, this is known as the aortic arch. Next time, okay, the next practical. Okay, might as well learn early. There are three major blood vessels that come off of the aortic arch. This one right here, right, is only short portions from here to here. And then it's going to give rise to this. This is known as your right coronary artery. And this is known as your right subclavian artery. But since both of these, this one's going to your head, This one's go to your arm. This short artery is known as the brachiocephalic artery. Okay? Brachial for arm, cephalic means the head. This is your brachiocephalic. It's the first major blood vessel that come off of the aortic arch. Okay? The second one is the left common carotid artery with this one. And then the third is this one right here is known as the left subclavian artery because it runs under the clavicle. Okay, so those are the three major blood vessels that come off of the aortic arch. But the question is, what is the first blood vessel that come off of the aorta? And the answer is? Shannon? The first blood vessel that come off of the aorta is the coronary artery. Okay? If I'm asking for the arch, see here, this is the arch, and it would be the brachiocephalic. But remember I told you in lecture, at the base of the aortic seminal valve or your coronary artery, so that would be the first major blood vessel that come off of the aorta. Okay? Which is, if you take this, you look at here, you will see this right here is your aortic, right, semilunar valve. So at the base of it, you have this blood vessel, and you have this blood vessel here. And how, if you look at that, there's an opening right, so like right there, there's one opening that comes out. There's an opening. So this is your right coronary artery, and this left. So left coronary artery is only really from here to here, small, which then split into this blood vessel. This is marginal?
No, sir.
It's in front.
Anterior interventricular.
Anterior interventricular artery, or left anterior descending, bring blood down. And then this one right here that comes across is circumflex, comes across. Right coronary artery give rise to this one.
Posterior.
This is the marginal, it's on the margin. And in the back is your posterior interventricular artery, right? Now running along, so remember, blood in the anterior interventricular artery goes down. But blooding that running along the anterior interventricular artery is this vein. It's known as the great cardiac vein, which brings blood up this way, which is bringing to this is your coronary sinus, which is bringing blood into your right atrium. Okay, as well as running along the posterior interventricular artery is this, is your middle cardiac vein. It drains into the coronary sinus, as well as this, running along the marginal artery is the small cardiac vein, which also going to the right atrium. There's two additional blood vessels that brings the blood into the right atrium, part of the venous return, which is this one. And this one is known as your superior vena cava. And then this one below is the inferior vena cava. In the cat, do we want to dissect the cat?
No.
This is known as the pre-cava, post-cava. All right, we'll save it for the vasculature in looking at the cat. So we won't do the cat heart today. The heart has three layers, right? The thick muscular layer here is known as your myocardium. This is your endocardium, and this is known as your epi, also known as the visceral layers of the pericardium. Very nice. Okay, so, okay. Now, the right ventricle pushes blood into this, known as your which is branched into these two. You see the blue color?
Right and left.
Pulmonary
arteries.
artery carry what kind of blood?
Yes.
It's blue. Okay. Now blood coming back from the lung. Okay. And one of the important questions: how many pulmonary veins are there?
4.
Oh yeah. Here you can see 2 here and 2 here. So these are pulmonary veins. That goes into. Where does blood in pulmonary veins goes into? Left atrium. Very good. All right. A couple more things. In the fetal heart, blood usually shunt from the right atrium to the left atrium via the foramen ovale. In adult, become fossa ovale. So this is fossa ovale. If you look at number 81, there's a little opening there. Right? So that's the fossa ovale. That should be closed. 81. Now, some of the blood do trickle down into the right ventricle, and it goes into the pulmonary trunk, right? But blood in the pulmonary trunk goes into lungs, but lungs are collapsed. What happened to that blood? It's shunted to the aorta via the what, Kathy? Blood in the fetal heart from the pulmonary trunk to the aorta. Ductus arteriosus or ligamentum arteriosum, which is this thing right here. This is your ligamentum arteriosum. You see that? So that's the important thing that you need to know as well. I love to put a green dot there and tell you what that is. It just have a nice name to that. All right, as far as the conduction of the heart is concerned, the pacemaker is known as, where does the pacemaker find? SA node. Okay, sinus atrial, look at where the superior vena cava comes in to the right atrium. Typically, voila, qu'est-ce que c'est? What is that? That's your SA node. When SA node fire, you get depolarizations of the atria, right? Leads to this right here, where you can't see, which is kind of like number, I think it's 100. You see here? What do you think that is? Part of the conduction. That's the AV node. You can see, you can look there later on, you can see that's your AV node in there. 81 is that? I think it's 100. That's an AV node, which then has to go through these, all of these is considered as the fiber skeleton of the heart, right? Which is then, do you see this? What is that? AV bundles, and see the little things right there? What are those? Purkinje fiber, and the Purkinje fiber innervate this, his Purkinje fiber, innervate this. What is that? Papillary muscle, very good, which is hold on to the chordae tendineae, for example. So then you have all these other things known as trabeculae carinae, right? And that's harder to test because, well, just know that it's trabeculae carinae, which is these networks right here. Okay? I won't test you about the trabeculae carinae. That's about all you need to know with this heart. Okay?